Okay, so probably one of the most common knee issues that I see comes from pain at the kneecap. And it has a lot of different names. And we always say if something has a lot of different names, that means you're seeing it on a lot of different kinds of people. So when a runner comes in, we may call it runner's knee. But for someone else, maybe somebody who has arthritis, we may call it chondromalacia patella. But the pathology, or what that means is what's actually going on, is really kind of the same thing. So what we're really talking about is pain that comes from behind the kneecap. So a little bit of anatomy. The kneecap tracks in a little groove on the femur. And that's controlled by the muscles of the quadricep, which are the big group of muscles on the front of your thigh. And in most people, the ones on the outside of the leg versus the inside are much stronger, more powerful, which adds into why this becomes a problem. So that big muscle, the quadricep, attaches through the kneecap, which then attaches down to the tibia bone. And so it's a vector of force that controls how the kneecap moves. And really, it's also a place that gets a lot of repeated motion, going up and down stairs, as I demonstrated a second ago, squatting down and bending, and even just walking and running. You get a lot of motion through the kneecap area all day long. And then when you're adding a sport into that, you get a lot of motion, and you're increasing the intensity of it. So what we're talking about is pain in the front of the knee. That's usually where people will point to when I ask them, where's your pain? It's right at the front of the knee. Sometimes they'll kind of try to point to the back of their kneecap. It's like back in there somewhere. And that's worse with running or with activity. A lot of times the stair climber is really one that makes things a lot worse. And then running up and down hills. We don't have a lot of those in Harlingen. But for runners, that's a really common thing when they start to train hills, if they're training, say, perhaps for a race that does have a lot of hills. So this is, again, the little groove that we were talking about. So this is kind of looking at the knee end on. With the tibia bone taken off, you're looking at the end of the femur. So that kneecap sits in that little groove. And for most people, it tilts off to the outside. That's pretty common. Chondromalacia is a medical term for the cartilage on the back side of the kneecap, or the cartilage anywhere, is starting to wear. So our joints are covered with cartilage, articular cartilage, just like the white stuff on the end of the chicken bone. I'm sorry, you guys are totally getting my back because of this crazy microphone. And so when we start walking at about 12 months, you're starting to wear that tread out, that lining on the top of the joint. And that becomes eventually arthritis. So chondromalacia is the early stages of arthritis. It's wear on the back of the kneecap. And then we can see that arthroscopically in a knee that we do a scope. This should look like a cue ball. It should be smooth and even, but you can see that irregular nature of it. That's what it looks like when you start to see wear of cartilage. So the pain is often caused by this mismatch of strength of the muscles on the outside of the knee versus the inside of the knee, pulling the knee more towards the outside, or laterally. Our term for outside is laterally. And the more that force pulls it toward the outside, the worse those symptoms can potentially become. So there are a couple of things that contribute to that. More common in women than in men, because the hips are a little bit wider, so that vector or that force is pulling it to the outside. It's more common in people who have pronation, which is when their feet go in, especially when you're running, or if you have a little bit of knock knees. And so all of those are just mechanical things that contribute to this. And then you have added into all of those sort of natural alignment issues, you have overuse, running, cycling, aerobics, jumping. It's really common in teenagers, and like I said, it's much more common in women. So there are a lot of things that we can do. This is almost exclusively treated non-surgically. This is a problem we very, very rarely need to operate on. And so first thing, obviously, if your knee's getting worse because you just increased your mileage running, or you started introducing the stair climber in your workout, or you started running hills, is to stop the offending activity, which is the hardest thing for an athlete to hear. The first thing you need to do is rest. And then we always recommend anti-inflammatory medications. And usually when I ask someone to take those, it's usually take the anti-inflammatory medications every day for a period of time, 4 weeks, 6 weeks, to really get that maximum anti-inflammatory effect of them. And then we ice it. You can just put ice on the kneecap after your activity, or if it's really flared up, a couple of times during the day. Proper shoe fitting is extremely important, and especially for runners, because if now running shoes have gotten so technologic that if you're running in a shoe designed for somebody who has a neutral stride, that means they hit their foot quite perfectly and it doesn't overroll one way or the other, and you or somebody who's rolling in when you run, you're really going to start to aggravate some things that maybe weren't bothering you before. So oftentimes we recommend that you see somebody who fits running shoes for a living. And so in Harlingen, that's Footworks, and in every city they've got a running store where people are trained to match the kind of running shoe they have to the kind of runner that you have. And then there's this little knee strap, which works in some people, doesn't work in other people. And the idea is to sort of take some of the pressure off of the kneecap as it's tracking, and for some reason we don't have good science for it, it does help a lot of people. And then the last one is VMO strengthening. Well, VMO stands for the vastus medialis obliquus, which is just the fancy way of saying it's the part of the quadriceps that's on the inside part of the knee. So most of the time the kneecap's getting pulled toward the outside. And so strengthening the muscle that helps pull it centrally, pull it toward the inside, can get that kneecap tracking better. This is the absolute mainstay of treatment for this particular problem. It helps work on keeping that kneecap centrally as you're doing your stressful activities you're running. And so these are just some examples of what those kind of exercises, and you can see this gentleman with the two fingers is pointing right to the VMO. That's what that muscle is on the inside of the knee. So terminal extensions, so not the whole straight leg exercise on this machine, but like the last 20 or 30 degrees really gets that VMO to engage. Wall squats, or wall squats with the ball, doing those really slowly can really get that VMO to engage. And you have to really, technique becomes really important, because if your knees are wobbly when you're doing it, what's happening is your stronger outside muscles taking over, and you want to have really good technique, and that helps engage that VMO and helps to strengthen it. So that's anterior knee pain. Moving on to iliotibial band syndrome, which is another really common running injury. So the IT band, as we call it, because we don't like to say iliotibial band over and over, the IT band actually starts as a muscle up on the hip on the outside of the hip. And that's called the tensor fascia lata. And then it turns into a very thick fascial band, a thick band of tissue that goes all the way down past the knee and inserts onto the small bone on the outside, the fibula. And so when you have problems with the IT band, although your pain may be at the knee, the problem is really coming from the whole upper part of the leg, because it starts at this muscle. So what happens is with running, stair climbing, sometimes just walking, I see people that don't necessarily have a specific injury that have pain here, can have to do with the alignment of their leg. We'll start to experience sort of some rubbing of this band on the outside of the knee that causes a lot of irritation. There's also a bursa, which is a little fluid sac that lives underneath it, and that can get inflamed as well. So why does it happen? Why does this start to become problematic? Well, one, the IT band can be tight. It's naturally tight. It's supposed to be tight. It's a really thick, tight band. But it also can be tightness or misbalance in the pelvic muscles. And really we're talking about the muscles of the butt, which is really important when you're running, because your pelvis needs to be stable every time you take a step and you go airborne on one leg, and then you're airborne completely, and then you're completely balanced on the other leg. Your pelvis needs to be stable. And if you have weakness in those pelvic muscles and it's shifting, it's going to irritate the IT band. It also can contribute to the anterior knee pain we just talked about. Slope surfaces, so we all are supposed to run safely against traffic. So you run repeatedly against traffic, but the side of the road bows like this. We see a lot of IT band, and interestingly enough, both legs. But it seems to be related to that running not on a flat surface. So I don't recommend people run with traffic, because it's really dangerous. But if you could mix it up with some treadmill running or some track running, or like something like McKelvey, where it's flat the whole way and you're not on that slope surface. Poorly fitting running shoes, again, huge contributing factor. And actually, when I very first started running, this is exactly what happened to me. I had some cute purple shoes back when they didn't make a lot of cute running shoes that I bought at Nordstrom's because they were on sale. And then I decided I was going to be a runner, so I started running, and then my IT band was killing me. So I went to a running store, I got fitted, and immediately it went away. I mean, within literally a couple of weeks and a couple of runs after switching shoes. So it can make a really big difference. And then, so what we talked about was pain on the outside of the knee, and then again, treatments are non-surgical treatments. Icing or ice massage, so you can take like just a Dixie cup and freeze it in the freezer. And then you can just rub it over that sore spot after you exercise. Ice massage is a fantastic way to get good penetration of that ice. Anti-inflammatory medications, again, that's what NSAID stands for, non-steroidal anti-inflammatory medications. Those are Aleve, Motrin, Celebrex, Mobic. There's a bunch of them on the market. Stretching of the IT band, strengthening of the buttock muscles, and then cross-training. So if running makes it hurt, cycle. Cycling makes it hurt, swim. Getting out of that sport that's really causing it to be flared up and switching that up with some other things to try and decrease that symptom while you're getting it under control. So these are some of the ITB stretches. Anybody not familiar with this torture device? Anybody familiar with this torture device? Who owns one? So this is the foam roller. This is the runner's best friend and also your worst enemy. Super, super painful to do this foam rolling on your IT band, but it really, really helps. And so you actually start all the way up at the hip, and you roll over that muscle we talked about up high, and then all the way down the leg. And it kind of stretches out that IT band, gives you a little massage, and it really can help relieve symptoms. But it's a little uncomfortable when you're actually doing it, which I can tell you from personal experience. This is an IT band stretch where you're crossing one leg over the other one, and you want to do it both ways, and just keeping the knees locked straight and going down as far as you can. And you'll notice that when one leg's crossed over the other, you get more of an outside stretch versus when you're just going straight down with your legs together. Same thing, this is another kind of variation of that, trying to stretch the outside of the leg. You guys have a bad view. And then this is my favorite stretch because it stretches your buttock muscles as well as your IT band, and it gives you just such a beautiful relief from your aches. Okay. So moving right along, another really common one. Who's had plantar fasciitis or pain in their heel? Super, super common place that people get pain. So what is plantar fasciitis, right? Everybody hears that term all the time, but what does it mean? Well, the plantar fascia is another thick band of tissue that runs from the arch to the toes, and it makes up your arch. That's why you have an arch in your foot, and along with some other tissues and some tendons that contribute to that. But it's one of the major components of your arch. And so classically, the pain is right where that sort of red sunburst is at the insertion of that plantar fascia onto the heel bone itself. That's usually where we see pain. It's tender when you push on it, but the absolute worst thing anyone who's ever had plantar fasciitis is going to tell you, you have a nice, lovely sleep, and you wake up in the morning refreshed, and you put your foot on the ground, and you want to kill somebody. It's just this really intense pain right at that base of where that fascia attaches into the bone, because overnight, it's kind of contracted a little bit, and then when you step on it with your full body weight, you stretch it, and it hurts. It's worse with standing, walking, running. It's better at rest, and again, that first step out of bed. These are some of the contributing factors, which is sad because I like cowboy boots. I have no problem with the high heels because I don't actually own any, so it doesn't bother me that they cause pain. But they do because they keep you in that position, and so when you stretch that fascia out, it gets a stretch. And then again, change in running terrain, adding mileage or adding hills, as you can see, is a really, in fact, I saw a runner in the office today who's having a problem increasing mileage. And she's like, I was doing so great, I was way ahead of my running schedule. I'm like, well, that's why you're in trouble, because the running schedule is slow for a reason, because you have to build up to these things. So it comes from a couple of different factors. Again, that excessive pronation, the feet go in when you're standing. But a lot of people don't stand like this. This is just a really dramatic example of what it looks like when the feet go in. More commonly, what happens is when you're running, you plant with your heel or plant with your midfoot, and then before you go to the push-off, it rolls in. And so it's a dynamic thing. You can't see it when you're standing, but when you're moving, you can see it. And so places like Footworks will videotape you and see how your foot is hitting the treadmill, and so you can really see dynamically how the feet are hitting and also whether or not you have a difference between one foot and the other. It comes from tightness in the Achilles tendon, so that is the single most important hallmark of the treatment for this, is stretching that. Again, poorly fitting or worn shoes, and then being overweight is a contributing factor to this particular problem as well. So this is also an example of excessive arch, which is also a factor. I mean, if your arch is too flat, it makes it hurt. If your arch is too high, it makes it hurt. But we know that those variations away from normal can contribute to these kinds of things, or average, not really normal, because that's normal, it's just not average. So plantar fascia treatment, again, resting from the offending activity, icing the heel, especially after any activity, anti-inflammatory medications. This is an example of a night splint, and the idea behind this is it never lets your foot while you're sleeping go into that low position so you don't stretch it in the morning, and it can relieve that morning pain. Stretching the Achilles is one of the most important things, and there are a whole bunch of different ways to do that. The other thing I hear people talk about going back to the ice and combining it with stretching is freezing a water bottle and then rolling your foot over the water bottle. That's a pretty common one, and you can stretch into that as well. And then, of course, shoes, and in some cases we even need some kind of orthotic, some kind of insert into the shoe, which can be as easy as just a padded heel cup or as complex as some custom orthotics, just depending on the severity or whether or not there are other factors at play. And so this is just another example of stretching. So this is Piriformis Syndrome. So this is kind of going full circle back to what we talked about, why the buttock muscles are so important. This is another way that the buttock muscles can become a real problem for overuse injuries. So we call it Piriformis Syndrome, and piriformis is a small muscle that's deep to your big gluteus muscles. And there are layers of gluteus muscles. There's gluteus maximus, medius, and minimus, so the big one, the medium size, and the small one. And then deep to that, there are these smaller muscles that stabilize the pelvic. So when you're in that single stance, I want to be on the stage showing you. When you're, your body weight's off, you're on one foot, the pelvis should be flat. And so I want to show you what I'm talking about. Okay, because I can't stand it. So when you're on one foot, the pelvis should stay even. But if you have weakness in the pelvic muscles, because mine does it sometimes because they actually are weak, if the hip goes down like that, when you're running, it's going to fatigue, and it's going to be stretching these muscles in the back. And so this is the big muscles taken away, and we're talking about these smaller muscles here. But the big ones are contributing, and the small ones are all contributing to that pelvis stability. That pelvis needs to stay flat when you're on one leg, and running is a lot of being on one leg, it's just alternating. And so as your mileage is increased, hey, I can run 3 miles, no problem. But as you start to run 9 and 10, the muscles fatigue, and the pelvis starts to tilt, and it can really aggravate a lot of things that go along this whole alignment issue. So it also sits really close to the sciatic nerve. So some people who have irritation from this will get sciatic symptoms, the pain going down the back of the leg, all the way down to the foot. And so that can cause some real irritation. So this is just a better view with really everything taken away and just really looking at those small muscles. But you can see that that big yellow thing that's labeled sciatic nerve is a sciatic nerve. And so it's really in close association with that. And that can make the pain deeper, and it can make the pain radiate down the leg. But mostly people kind of point right to the center of their buttock cheek, right in the center of that. And I'm pointing because I've had that pain too. I've had a lot of these things. Worse with running and stair climbing, and a lot of times when it's and people have trouble just sitting, just have pain when they're sitting. And again, it can cause radiation down the leg. So this is my favorite stretch because it hits 2 things. It hits iliotibial band, and it really stretches out the gluteus muscles and the piriformis muscle. Stretching is really an important component. And then one of the other really important things, is another good stretch, are strengthening those pelvic stabilizers. So all of these exercises that back in sort of the Jane Fonda days, which were kind of women's exercises because they're supposed to make your buttocks nice and firm, really those are very important exercises because they're stabilizing these pelvic stabilizers so that you can be on one leg and continue to be powerful on one leg. And those kinds of things can make a huge difference in recovery from this injury. And it can be surprising how if you have this irritation on one side, how weak one side is compared to the other. And then again, it always comes back to proper shoe wear. It'll make you crazy with the proper shoe wear. Okay, so I was reviewing my slides and I thought, man, this is lower extremity heavy. So I wanted to do at least something for the upper extremity. So this is my one upper extremity, which is an extremely common problem, tennis elbow. How many people have had tennis elbow? It's crazy common. And the funny thing is, you don't have to play tennis. It's actually much more common in people that don't play tennis, although it's pretty common in tennis players. And really what it is a degeneration of the insertion of one of the muscles, which is the extensor carpi radialis brevis. But it's one of the muscles whose job it is to pull the wrist up, which is kind of a classic tennis move. You bring your wrist back. And it's not really an itis. It's really an osis. So its name was lateral epicondylitis, but the difference between an itis, inflammation, and an osis is degeneration. So it's actually, if you look under the microscope of people who have had this problem, the tendon's actually degenerating. And that's why it's causing an inflammatory response, and that's why people have pain. So most commonly it's right over the bony part of the outside of the elbow, and worse with certain activities. So anything that you're doing that's bringing that wrist repeatedly up is going to cause pain there. And people will have point tenderness right over that. They can show you the spot exactly where it hurts. Pouring, sweeping, and another one. Oh yeah, and tennis. I don't remember what my third picture was. And tennis. All of those things can cause irritation, and it's a repetitive motion that's happening over and over again. But we see it in plumbers, electricians, people that build fences, people that really are working with their hands. I actually know several surgeons who have it off and on over time. Again, it's one of these things that you have the morning stiffness. So most of the exercises we talked about today are all therapy or rehab or exercise stretching intensive because they're really not surgical problems for the most part. And that's true for this one as well. So this is an example of strengthening the forearm muscles by doing this kind of eccentric ball squeezing. There's a treatment that the physical therapists use called cold laser. I have no idea how it works. But they have this little laser treatment where they go over the area that's inflamed, and you can really, and I think we have a therapist in here who might be able to explain it to us, that can really decrease the inflammation in that area and decrease the pain in that area. Again, anti-inflammatory medications, we've already said it's not an itis, it's not really an inflammation, so why are we treating with that? The answer is because it works. It helps decrease the pain that people have, and so it can make a big difference. This is where ice massage is really, really awesome. Those frozen Dixie cups, just going over and over that sore area, can give you a lot of relief and help it resolve over time. And we usually give it a lot of time to get better on its own. It's a degeneration, so it kind of goes through this inflammatory phase and settles down. It doesn't stop being degenerated. It doesn't heal, but it does stop hurting. And so we usually give it up to a year, trying to control the symptoms along the way. I didn't put on here for treatment cortisone injections, but we do very judiciously and occasionally use cortisone injections for this. When cortisone is injected right into tendons, you can cause tendon rupture. So usually most people will say, we'll try cortisone one time. If it works, great. But we usually don't repeat it because we don't want to make things worse than it is. And then if people don't get better in about a year, we do surgery and basically just open it up, remove the damaged part, close the healthier stuff back together, and keep them out of trouble for 3 to 4 months until it heals, and then send them back to sport. And it's pretty effective when it's necessary to do that. That's a picture of the cold laser. I was a little slow on the uptake there. So I think that pretty much covers. I wanted to tell you that a family that runs together stays healthy together. These are my daughters. This is a couple years ago when we did a Disney race. And then just wanted to leave you with a little bit of my contact information.